Basis Health is working to make care more accessible and more personal for the people it serves. Today we're learning about the organization, what sets it apart, and why services are filling an important need in our community. Thanks for being here. Great to see you as always.
Appreciate you having us.
Absolutely. So tell us, I know I kind of set you up, but tell us a little bit about Basis Health.
Yeah, so Basis Health's mission has been the same since its inception 5 years ago, is to increase access to health care to the most vulnerable patient populations, which is that elderly patient population, multiple chronic illnesses, maybe have some issues leaving their house. Our mission is to bring the healthcare clinic into their home. So we have multiple services, IV hydration, primary care, and we just opened up an urgent care as well. So those patients who like their primary care, don't want to have to change doctors, they can still get urgent care in their homes instead of having to get in the car, get all the way over to a clinic or an ER.
Oh, wow.
Yeah.
Okay. So what makes Basis Health unique?
So it's unique that we're one of the only companies in this region and honestly in the country that combines all of these services into under one umbrella. So really a patient goes into our service, they can get wound care, IV hydration, primary care, medication management, and now we have our own lab services as well. So, instead of taking 5-10 days to get your lab results, usually you can get it within 24 to 48 hours with our services.
Wow. And it's all mobile? Everything you do is mobile?
Everything we do is mobile. So wherever the patient is, independent living, assisted living facility, or in their home, we can get to them.
And why do you think that is important to the community?
There is a huge population of patients that have just been left behind in the healthcare system. We have hospitals that are closing. We have patients who don't have access to healthcare in our communities. This service bridges that gap and gives the opportunity for every patient to have access to high quality healthcare in their home where they need it. And the goal is to try to keep them in their home where they're the most comfortable and where they're the healthiest.
Yes,
Yeah.
sure.
What type of feedback have you been receiving?
It's been incredibly positive. We've had patients who their kids have literally called us and called our doctors and said, "You've saved my parents' life." Like it has completely altered their whole life because now they have a physician or nurse practitioner coming into their home. They don't have to worry about getting in the car. It saves from falls. We really have changed the way healthcare is delivered in this region. And it's our hope that we're going to continue to change that and spread that out to other communities where we can help change that community.
Yeah, and you're even adding new services like you just mentioned a moment
Consistently.
ago. So that's amazing. What do you love about it on a personal level? What do you love about what you do?
I mean, it's rare that you get to wake up in the morning knowing, hey, we're going to change people's lives today. Like there are people who, without our services, without this company that we built, would not have access to health care that they need in their homes. So the ability to wake up in the morning knowing, hey, we're going to go save some lives today is something that's hard to beat.
Yeah, sure.
Why is this service necessary?
Healthcare system in this country and in Arkansas specifically has been struggling for some years. I just read a report the other day that all these hospitals are closing in the country, but specifically here in Arkansas. So there's rural areas where people just don't get access to healthcare. So having a mobile urgent care, a mobile primary care that can get to some of these patients who otherwise would be left at home and they would have to wait for one of their family members or some type of community resource to get them somewhere,
Sure.
we can go and get to them. And it makes all the difference for people.
That's amazing. And I love what you said about keeping people in the space where they feel most comfortable, right? Because there's something daunting and intimidating maybe about going to a hospital or a clinic or whatever. How do people access you? Do they call you when they're in a moment of panic? Do they plan for it in advance? Like, how does the process
So they
work?
do it both ways. They can go to our website, basishealth.org. Our flyers are everywhere. They're able to see who we are. But we also have this urgent care service, which we are now expanding to all ages. So if you are at home and you're like, hey, I'm not feeling well, I'd rather not wait in the line at a urgent care. I'd rather just have somebody come to me and take care of me. Maybe it's a bag of IV fluids you might need. Maybe, who knows what it is. You can give us a call, and we usually can schedule something within 48 hours. Have a provider in your home taking care of you and checking you out.
Well, thank you for joining us today and for the work that you're doing, providing that health care for people who need it in our community. We appreciate it.
Thank you.
Absolutely.